This video is about the oxygen supply and demand framework. In particular, we are going to focus on hemoglobin level and understand how the hemoglobin level affects oxygen transport in the blood, because hemoglobin carries oxygen, all the way down to oxygen supply and balance. So the oxygen supply and demand framework is helpful because it helps us integrate systems. In this framework, all kinds of systems are represented: the renal system, cardiac, endocrine, the respiratory system. And this framework tells us if someone is in a balanced oxygen supply and demand situation, meaning they have enough supply to meet whatever the demand is. Their cells are getting enough oxygen, their tissues are getting enough oxygen. And this video is about how hemoglobin level plays into that. So we have to understand a few things about how oxygen is carried in the body. And when I'm teaching, I always tend to draw hemoglobin and red blood cells like this, as if the hemoglobin was attached to the outside of the red blood cells. I just draw it like that so that we can understand you need a red blood cell to carry hemoglobin, and hemoglobin binds with oxygen. But what's actually happening in the body is one red blood cell can hold about 300 million, between 250 and 300 million hemoglobin units. And of course, each hemoglobin unit can carry 4 oxygens on it. So one red blood cell actually carries about 1 billion oxygens. If you don't have enough red blood cells, or they don't work properly, or you don't have enough hemoglobin units, you are going to have anemia. Anemia is a pretty general term. It means a reduction in the oxygen carrying capacity of the blood. There's many different kinds of anemias, and we categorize them by the size of the red blood cell. So the first category is microcytic anemia. Then we have normocytic anemia and macrocytic. So just by the names, you can probably guess that microcytic, the red blood cells are smaller than they normally should be. Normocytic means the red blood cells are the size they should be, and macrocytic means they're too big. And how do we actually measure the size of red blood cells? Well, it's something called mean corpuscular volume. Mean means average. Corpuscular means body, like the body of the cell. And volume is the size. So it's the average body size of a red blood cell. In microcytic anemia, you're going to have a reduced mean corpuscular volume. In normocytic, it's going to be okay. And in macrocytic, it's going to be increased. So microcytic anemia, the problem here is there's not enough hemoglobins. So if there's not enough hemoglobins, the red blood cell bag never gets filled up. So you end up with smaller than normal red blood cells. And there's a few different kinds of microcytic anemia. There's iron deficiency anemia. So you're literally just not getting enough iron, and you need iron to make hemoglobin. There's something called anemia of chronic disease. And when you have a chronic disease, you tend to be inflamed. And when you are inflamed, you don't absorb iron nearly as well as you could or should. And the iron you do have and the iron that you do absorb, it's kind of locked away. You can't access it when you're in an inflamed state. There's something called thalassemia, which is a genetic problem where the body can't make globin chains, and that means there's defective hemoglobin. And there's also something called sideroblastic anemia. Iron is available, but it's not being incorporated into the heme, so you don't have enough hemoglobin units. That's microcytic anemia. Normocytic, the problem is not enough red blood cells. So the ones you do have are the correct size, but there's not enough of them. Examples here would be blood loss, any kind of acute or chronic blood loss. Aplastic anemia is under this category. So bone marrow failure, your bone marrow is not making red blood cells anymore. That's 2 examples of normocytic anemia. And then we have macrocytic. So the problem here is, well, there's actually 2 kinds of macrocytic anemia. So I'll just draw this like this. There's megaloblastic, and there's non-megaloblastic. So in megaloblastic anemia, the problem is a DNA problem, and the cells can't divide properly. The red blood cells cannot divide properly. So you end up with large, immature red blood cells that don't work properly. And there's actually 2 categories of megaloblastic: vitamin B12 deficiency. So this could be from pernicious anemia. So that's an autoimmune condition, or malabsorption. You aren't absorbing B12 anymore. And if you ever need to remember where different components of the oxygen carrying capacity of our blood get absorbed, there's an easy way to remember it. So in the duodenum, that's where iron is absorbed. In the jejunum, that's where folate is absorbed. And in the ileum, that's where B12 is absorbed. Dude is just feeling ill, bro. That's how we can remember where all these different components are absorbed. So that's vitamin B12. Those are possible vitamin B12 deficiency anemias. There's also folate deficiency anemias. And this is from reduced intake, for example, alcohol, or increased demand. Pregnant women have an increased demand. The non-megaloblastic is not a DNA synthesis issue. So the cells can divide. DNA replication is normal, but something else is affecting how they're made. So it could be alcohol related, liver disease, a hypothyroid problem. And we could actually spend hours talking about each different kind of anemia. But as the average bedside nurse, the average critical care nurse, you're going to see a few kinds more commonly than others. You're going to see iron deficiency anemia, anemia of chronic disease, blood loss anemia, and vitamin B12 deficiency anemia is the most commonly. So another way of saying that is saying that you're going to see most commonly patients that don't have enough iron or they can't use it. They're losing their red blood cells, or they have some kind of absorption problem. And the absorption problem could be autoimmune, like in pernicious anemia, or some other kind of malabsorption problem of vitamin B12, which is we know is absorbed in the ileum. So how does all that work into oxygen supply and demand? Well, if you don't have enough hemoglobin, whether it's because you're not making it, because you're not getting enough iron, or if it's because you don't have enough red blood cells. So remember, red blood cells carry hemoglobin. So if you don't have enough red blood cells, that means you don't have enough hemoglobin. Or if it's because your red blood cells are just not working properly, that means you're going to have a decreased oxygen carrying capacity. And that means you might have a diminished oxygen supply. So when we give people oral iron supplementation or iron infusions or packed red blood cells, we are actually increasing their oxygen carrying capacity. So that's a quick summary about how hemoglobin level impacts oxygen supply.